I have to be really careful about how I go making this video. So first off, I'm not giving medical advice. I'm not advising or prescribing. What I am doing here is using this commenter's comment about something to educate others and encourage them to go and learn more for themselves. There are some medications that are used to treat pelvic pain, period pain, and endometriosis. One of them is hormonal birth control. Another category of medications used are GnRH drugs. There's two of them. One is called Lupron, one is called Orlissa. GnRH drugs use a hormone that controls the secretion of other hormones, LH and FSH. Orlissa is the pill version of Lupron, the original medication used to treat pelvic pain, period pain, and endometriosis. However, that medication was not created for that purpose, which makes it quite controversial. Lupron was first created to treat prostate cancer, and using it on people with period pain, pelvic pain, and endometriosis has actually had some pretty severe adverse effects. If you're curious about what those are, I actually have them information for this and sources linked in my blog post, which is linked in my bio. So Lupron is a hormone agonist which prevents the receptors in the brain from releasing sex hormone. What does that mean? It kickstarts menopause. This is what we call medically induced menopause. It does this by reducing the buildup of the uterine lining. Symptoms of Lupron include things that people experience like when they're going through menopause. Night sweats, hot flashes, mood changes, weight gain. But when we talk about adverse effects, I'm talking about the extreme. People no longer being alive because of it. And yes, the information is out there if you dig, but you've got to dig pretty hard because Big Pharma does a really good job at using their dollars to hide this information. If you're a person who uses Facebook, you can go to Nancy's Nook and search the name Lupron in the search bar, and you will see a number of articles and medical journals and information about this. Moving on to Orlissa. Orlissa is the pill version of Lupron. It was kind of created after Lupron, and it is being used to treat period pain, pelvic pain, and endometriosis. But as of this point, it has actually not been proven to work any better than hormonal birth control. And we still don't know enough about this medication because it is pretty new as far as what the long-term side effects are. And given that it's tied to being a GnRH drug, just like Lupron, and Lupron has had so many problems. So let's talk about money. Lupron and Orlissa can run about $800 to $1,000 out of pocket out a month, potentially for some people, depending on their insurance. Whereas hormonal birth control could be free or maybe like $5 out of pocket, give or take, right? Depending on insurance. And remember, Orlissa has not been proven to work any better than hormonal birth control. For endometriosis, the actual type of hormonal birth control matters, which is why you need an endometriosis specialist to be prescribing that to you.